The right time to start breastfeeding counseling is when you're planning to get pregnant. Why is it important to do breastfeeding counseling at the time of pregnancy is to check for any retracted nipples. Most of the time, mothers come to me after delivery with a lot of pain and try to understand about breastfeeding. It is very difficult for them to understand and follow the instructions when they are in pain. So if they get all these instructions before they get pregnant or during pregnancy, it will help immensely. When is breast milk secreted? Most of us are in the impression that milk is secreted only after the delivery of the baby. No, milk is secreted even during pregnancy and sometimes even before they are pregnant. It is known that some of the males are also known to secrete some breast milk and they can even feed a baby. When to initiate breastfeeding? It is important to initiate breastfeeding as early as possible. It is recommended to start breastfeeding within 30 minutes following normal delivery and within 4 hours following a C-section. As discussed earlier, milk is secreted even during pregnancy, but it doesn't flow out because the lactiferous ducts are blocked by some plugs. The vigorous sucking of a baby can remove all these plugs. So if we can initiate breastfeeding early, we can make sure that the milk flow is better. What is proper latchment? Latchment is the most important part of breastfeeding. We need to ensure that the baby latches properly to the breast. I try to explain this with this 4-point concept. The first is that the chin should be touching the breast and there should be enough space between the nose and the breast tissue. The second point is the mouth should be wide open. Most often it is a challenge to open the mouth of a baby. The mistake most of the mothers do is that they try to feed the baby as soon as they start crying. It's important to wait for them to vigorously cry. A vigorously crying baby will open their mouth wide. Wide open mouth should be in a U shape. The lips should be in a U shape, not in a V shape. If they are in a U shape, only then offer the milk. If not, push the chin down with your thumb. Make sure the mouth is wide open before you can latch the baby. Once the baby is latched onto the breast, we should make sure that the lip is averted. The lower lip should be averted. It should be facing downwards. That's the third important step for latchment. The fourth and the most important thing is that the baby should be suckling 3/4 of the areola. It should not be just the nipple. It should be nipple with the dark part of the skin, that's called the areola. 3/4 of the areola should be within the mouth of the baby. Only a thin rim of areola should be visible when the baby is latched. Improper latchment will lead to cracking up of the nipples and pain, soreness of the breast. What should be the position of the mother during breastfeeding? It's very important to understand that babies are totally flexible. You can touch the heel of a baby to the ear. So they are so flexible, don't worry about a baby. It is the comfort of the mother that is important. You can do it in a lying down position, you can do it on a sitting position or do it in a leaning forward position. Whatever is comfortable for the mother is comfortable for the baby. From the baby's side, we only tell you to just support the neck. So just supporting the neck of the baby while breastfeeding is good enough. How long should I feed my baby? So usual feeding time is between 5 to 10 minutes, depends on the vigor at which the baby is suckling. So most often by the end of 10 minutes, the milk is emptied from the breast. It is important to feed only one side at a time and not shuffle around between two breasts within one feed. Sometimes babies tend to continue to breastfeed beyond 10 minutes. Need not get stressed about this. You can just allow the baby to suckle as long as they are comfortable, even if it goes on for 45 minutes or an hour. You can just try to relax during this period. Babies are not going to get milk beyond 10 minutes. It is just a non-nutritive suckling which gives comfort to them. How frequently should I breastfeed my baby? This is one of the commonest mistakes which new mothers come across. Most often we see that they tend to feed the baby every time they cry. Every cry is not hunger, but the most commonest reason for cry is hunger. It's important to give a minimum of 2 to 3 hour gap between feeds. Say you've started your feed at 8 o'clock and it went on till 8:15. Make sure you can give a time of 10 o'clock before you start your next feed. Around 10 feeds is good enough for a baby. A healthy baby will require 8 to 10 feeds per day. Coming to burping, it's important to burp a baby following a feed. We recommend a minimum of 10 minutes of burping following each feed. It's not necessary that the mother alone should be doing the burping. The father or the other parents can help the mother in burping the child. The longer you burp the child, the better it is for the child and the better it is for the family, because the child will not have colics. The other role of parents and husband in taking care of the baby is KMC, Kangaroo Mother Care. So in this, we recommend babies to be kept on the bare naked chest of an adult so that they get the natural warmth of the adult. KMC is very essential for low birth weight babies and preterm babies because temperature is the most important thing to ensure they grow well. The next major challenge one will come across is cry. It's important to know that a baby can cry for up to 3 hours a day. There's nothing to worry about a crying baby. We are only worried if the baby is not suckling and not crying. Do not rush to a hospital for a crying baby. Try to analyze what could be the reasons for cry. As I've already mentioned, the most common reason for cry is hunger, but not every cry is hunger. It's very difficult to differentiate a cry of hunger from the rest. There have been a lot of scientific studies which have been done to try and analyze the type of cries, but we still do not have a solution for this. So whenever your baby is crying for beyond 15 minutes, try to look for a nasal block, or if there is a colic, rash on the diaper area, or any insect bites, too tight clothes, too loose clothes, or if you have wrapped up the baby too much that it is having some discomfort. Try to identify the cause for the cry. If it is a nasal block, you can just use some saline nose drops. If it is a colic, you can just take some warm oil and massage the stomach from right to left side in a circular fashion around the umbilicus. If you notice a diaper rash, you can just apply some Vaseline or coconut oil in the diaper area. If there are any tight clothes or too loose clothes, you can just get them corrected. The next and the most important thing is adequacy of breastfeeding. How do I know if my baby is getting enough milk? So the most important thing which can be monitored at home is the urine. A normal baby who is getting adequate breast milk passes 6 times of urine in 24 hours. So try to count the urine only when you are in a doubt. So if the baby is passing less than 6 times urine or more than 15 times urine, it is not normal. It's better to consult with your doctor. Apart from urine, you can just look for the weight gain. So if the baby is gaining adequate gain of weight, then he is getting enough amount of urine. And the remaining things are all minor, which can help in knowing if the baby is getting adequate milk, that is having a continuous sleep for around 2 hours following a feed. If the mother gets a letdown of milk from the opposite breast where she is not breastfeeding, it also indicates that they are getting enough milk. Let me sum it up. The most important part of breastfeeding is the comfort of the mother, both mentally and physically. Latchment should be proper. And if you have a doubt about adequacy of breastfeeding, just count the number of times your child passes urine. In doubt, try to consult an expert. Strongly recommend mothers not to top feed or bottle feed their children, and try to take an expert advice whenever in doubt.